Hi, we're excited to be here. Another dietitian talk. We love having these and holding these every single month with our amazing team of registered dietitians. And for those of you who might not know us yet, I'm Delia Marin. I'm a registered dietitian nutritionist. I'm a certified gut nutritionist, and I specialize in helping you and your fam heal with each meal and helping you eat and tolerate more plants by healing your gut.
And I'm James Marion, Integrative Registered Dietitian, Environmental Nutritionist, co-founder of Married to Health. We have here...
I'm Katie. I am a licensed registered dietitian. I'm also a PhD student studying dietary interventions and breast cancer. And I specialize in women's health, general plant-based nutrition, and also supporting people along their cancer journeys.
And hello, I'm also known as the Emotional RD. I'm Laura. I'm a registered dietitian, licensed, and I specialize in emotions. I help high achievers create a great relationship with food, their emotions, their bodies, and most importantly, with themselves. Women's health is one of my passions, and as well as gut health. So happy to be here.
Awesome. And today's topic, we're going to be doing a dietitian talk on women's health. So I think it's a perfect time to discuss women's health, women's nutrition, all things having to do with women, with females. I'm just going to be a nice little spectator here and just give very little input. No, I'm just kidding. But you know, we have not only women here, but registered dietitians, and especially with various specialties in different areas. So this is a very exciting time. For those watching live, we'll be happy to answer any of your questions on this topic. And we're excited to kind of dive in. I think, where was
and I'm excited to talk about this topic specifically with the two of you as well, because we do know hormones are so closely tied with our emotions, with the gut, and also with what we're eating. And Katie, I think, specializing in, women's health and breast cancer. What more important topic is it to talk about than female hormones? So I'm excited to have this conversation, I think, with you two in particular, and really dive into this and really hear your expertise in your field and your area of focus and your area of niche, because I think so many people have so many questions about hormones. Somehow they're still somewhat of an enigma. So hopefully we will clarify things for one another, for those who are tuning in here live and those who might have asked questions on Instagram or elsewhere and might ask questions later. So we're excited to get into it.
And I think we wanted to kick it off with something new. We wanted to show a clip. So TikTok is popular, Reels and Shorts and all these clips and all these videos we see. So I think we want to put a little reminder out there, or just shout out. If you come across a clip you want us to review or look at, send it to us. You can send it to info@marriedtohealth. You can contact us through marriedtohealth.com. You can DM us on Instagram @marriedtohealth with a clip. But we have a clip here that we want to show. And I think, just a reminder to everyone, we'll mute as we show this clip. But I'm going to share this clip coming up. And I'm going to first, give me 1 second here. There it is. All right, give me one. I'm going to mute, and then I'm going to turn on the audio, and we'll take a look at this clip here.
The truth. The truth.
Alrighty, so I know the audio was, for those of you, I don't know if you can hear it at home or for those watching, the idea of this clip that you're hopefully still seeing on the screen here is basically when a cancer survivor tells me their doctor told them soy increases cancer risk. So, and then the caption, I know, Katie, you found this clip, which is great. And we see this a lot all over TikTok, all over the internet. Soy is going to give you breast cancer. Don't you know? I know this is a whole nother topic, but men, soy is going to decrease your testosterone. But it's funny because that is definitely related to the mechanisms of soy, or so we think, right? That soy is going to cause cancer and soy is going to give you all this. So I would love to hear everyone's thoughts on soy causing breast cancer specifically, or cancer in general?
Yeah, I'll kind of kick it off. First, I can try to share my screen and see if I can do that. But if not, we'll kind of continue on. But in terms of soy, soy is so many different food items. It's just a broad category. So you have soybeans like edamame, soy milk, tofu, tempeh, miso. You have soy meats and soy cheeses and so on and so forth. Some being a little bit more of the whole food side of things, some being more on the processed to highly processed foods. But in terms of soy, this is such a common misconception that people have, and not just doctors, even though the clip is a registered dietitian talking about doctors, but we hear it all the time. But in fact, those regions around the world that consume the most soy actually have the lowest rates of breast cancer. And it may not just be diet, but it is an important component to look at. And for example, Japan, Singapore, vegan populations, China, vegetarians, those are kind of the categories that have been shown to have the most soy intake, and more specifically, the most isoflavone intake, which of course comes from soy. And our Western countries, just as other components of food are involved, like fiber, our Western countries are really falling behind some of those other countries. And with that, we also see higher rates of breast cancer, unfortunately. And with soy, I mentioned those isoflavones, and genistein is one of the most researched isoflavone that is currently kind of being looked at. And what they do, you may have heard of like phytoestrogens, and that is kind of what people say, well, phytoestrogens act like estrogen, and therefore they can increase your cancer risk. Well, yes, they are phytoestrogens, but what they do is actually the opposite of what it sounds like. So there are two types of estrogen receptors. I'm going to get a little nerdy for a moment.
Love it.
But we have alpha and beta estrogen receptors, and our isoflavones tend to bind more to those beta receptors. And the beta receptors are suggested to actually have more of a protective effect and help suppress rapid cell division, which is like a key component of cancer, rapidly dividing cells. So soy, in fact, kind of does the opposite of what people are afraid of it actually doing. And in addition to that, I have a couple stats just to kind of throw out there for people if they are interested. The American Institute for Cancer Research has very clearly on their website that soy is of no risk for breast cancer. And in fact, it's not just a neutral food, but it can help, like I said, decrease that cancer risk and also decrease the recurrence of breast cancer, which is really important because when women and people with breasts are diagnosed with breast cancer, recurrence is a really scary thought to them after they go through those intense treatments. So finding something that they can take a little bit of control over to help decrease their recurrence, the chance of recurrence is really important. And about 1 to 2 servings of soy a day have been shown to have that no risk and beneficial aspect, even up to 3 servings a day. And so a serving is like a cup of soy milk, a third of a cup of tofu, just to like put that into perspective. And so I'll let others kind of talk on this as well. I have a couple more stats, but I just want to kind of open up the floor to everybody else as well.
I love this. I think these are such important things to know. And I love how you shared stats, because I think that really gives people kind of a data point to say, okay, am I consuming 3 servings of soy a day? I think even, I can say us in our home, we're all plant-based. We don't consume even 3 servings of soy a day. So I think it creates this space of more comfort for people to understand, well, I'm not consuming that much soy. And even if I was, it is protective. So I love that you were able to break that down and really describe the different types of soy, the different types of estrogen receptors that we have in our body, and the different types that can be a little bit more cancer promoting versus cancer reducing. So I think that's so important for not just females to understand. I think it is important for females to understand that, but it's just important for anybody everyone to understand, because males also have those alpha and beta receptors. And, just because males don't have the same rate of breast cancer as females do, which we'll talk about why that is, I think it's so important that everyone really has access to this information. And we finally, I think, are coming around to putting this myth to bed. And I know that this myth has been around for a very long time. My mom had breast cancer twice in her life, once in the early 2000s, or, like late 90s, early 2000s. And even then, this was being dispelled, because I remember my whole life, my mom would say, I can't eat soy. My doctor told me not to eat soy. They told me to stay away from soy. She would not buy soy products and soy foods for us to consume in the house, because it was ingrained in her very early on. And I remember so many others saying, oh, yeah, don't eat soy. Soy is so bad for you. Soy is going to make you get cancer again. So I think it's so important that we have this conversation. And so many others are starting to have this conversation, have been for the last couple of years. But there's still this strong misconception out there. So thank you, Katie.
And then just a reminder for those watching live, we can answer your questions. We can see your comments in the chat below. We have a comment coming in. I come from China. Soy is a regular food in our diet. Thank you, Katie, for sharing that info. So cool. Yeah, we know. And whether you're talking about blue zones, or you're looking at epidemiological studies, you're looking at some of the populations where they consume quite a bit of soy, like China, you're seeing overall good outcomes from plant-based protein sources like soy. So I think, yeah, it's really difficult when you look at all this data and you're like, what is this, like, what is this standing on, right? What is the foundation of these claims, when all these negative claims of soy? And it's like, when you look at the data, it's just not there, right? From a depending what level you're looking at the data, right? Epidemiological, crossover studies, or I mean, you're really just looking at animal studies. I think we mentioned this before in a past live. We're looking at animal studies, but they're feeding like ridiculous amounts of like soy isolate. And so the context matters again, right? It's like, unless you're someone who's like getting a massive soy isolate supplement and is just downing it every single meal or multiple times a day, could you have a negative effect? Sure. Just like with anything. If you did that with anything, I think you'd have some sort of negative effect. So that context really matters. So very cool. Thank you for the comment. And thank you, Katie. It's very good. I mean, again, like Dalia was saying, it's an important conversation. I like talking about this because I do consume soy. We consume soy. And it's not just enough to say like, I consume it, so therefore it's good and I'm okay, so you should be okay. Just like I wouldn't say that, I don't think it's okay for someone to say like, well, I don't consume it, so you shouldn't either, because it's not okay. Well, it's like, you gotta back it up more with just what you do, right? And I think the benefits of soy are there. I've yet to see kind of the risks in terms of all the negatives. And so, yeah, I'm curious, does anyone really know where this is coming from? Is it really, I mean, I'm assuming that it's really just coming from a certain subset of people reading the studies of animals and then just automatically then putting it onto patients and people, right? I mean, I would assume that's kind of where some of this is coming from.
Yeah, and I would say, just jumping in from a research perspective, there are sort of different types of research in terms of like diet and other components. You have cell cultures, which is basically having essentially a petri dish with a cancer cell or with any type of cell you want. You also have animal models, which we know animals don't always and often don't equate to humans. And then you have human studies, which can be observational, randomized controlled trials, and so on. And within human trials, there's also different levels of that hierarchy of evidence. So a lot of studies will start out with cells in animal models. From an ethical perspective, you can't really just jump into a human trial without having a basis and a reason for it. But people do tend to kind of run with the information found on those cell research and those animal research, because that human research hasn't really been developed enough yet. So they do tend to kind of jump on that and run with it, which a lot of these myths can come about from that.
Totally. And I'm seeing some other questions come in. I want to put out this disclaimer as well. This is not medical advice. This is a discussion. We are registered dietitians. Consult with your care team, consult with hopefully a really well integrative care team who knows you and has your best interest. But so we're just kind of talking generally here. I do want to touch on, I see a great comment just on the topic of soy, and then we'll move on because we're seeing some other really great questions. A comment came in. The way it's grown makes a huge difference. I'm highly sensitive to soy. And that is one thing I'll say. I mean, we are big fans of the precautionary principle. And I think in general, this idea of genetic modification, I should say, using gene, like a gene gun, is something fairly new. And I don't think we have a lot, I don't want to say, I don't think we have a lot of long-term population data on it because it's so new. This goes down the rabbit hole of like genetic modification as a whole, but not to go too far down that rabbit hole. And definitely want to hear if anyone has any opinions on this. But I do think when it comes to genetically modified soy that is Roundup ready, because a soy crop can be Roundup ready, you are getting an increased amount of Roundup on that crop. And we do know this is something that EPA does test for is pesticide residue. And there have been some decent studies, especially in the EU, showing, a correlation with pesticide exposure and cancer. So yeah, I mean, definitely the environment matters, and the environment for the plants you're eating matters, right? Whether we're talking about the soil microbiome, we're talking about chemicals coming into contact with the soil, with the plant itself, and then humans being exposed to this. Multiple lawsuits. I know Roundup is for those that don't know, Roundup is an herbicide. It was owned by Monsanto. Now it's Bayer. Again, a big rabbit hole there. But anyone, I mean, commenting on that. But yes, the way it's grown can factor in. I think more and more studies are going to come out with that to kind of solidify that. But some decent ones for now that are there. But
so it might not be the soy, it might be guilty by association. And I think that's why it's nice that we have these opportunities to say, okay, maybe I'm sensitive to non-organic soy. Let me try organic soy and see, is it the pesticide? Is it the food itself? And really understand the data behind the food itself, the soy itself,
right.
And say, okay, what is my susceptibility to cancer based on just soy in and of itself? And I think that's so, so, so important. And one other question that we got about soy is someone's asking, what does soy really do to testosterone? What does it do to testosterone? And Katie, I'm going to defer to you because you're. I don't know if you have an opinion on this, but I haven't come really across any data that shows that a moderate amount of soy will affect any hormone levels at all.
Yeah, I definitely would agree with that statement as well. As it's all in kind of moderation, which is, I think, a dietitian's favorite phrase is, well, it depends, and it's in moderation. And so people don't always like when dietitians have to say that, but it really is. Moderate intakes of soy aren't going to negatively affect your health, your other hormones, things like that. As I think James had mentioned as well, with like, in terms of what does that moderation look like? And if you had too much vitamin A, that would be highly toxic. If you had too much, which if you don't have enough vitamin A, that's also a bad thing. So it's kind of in terms of
same with vitamin D.
Exactly. So that moderate amount, that 1 to 3 servings a day is really the goal in terms of reducing risk for breast cancer and really with other elements as well, the fiber found in those foods, the protein found in those foods. So all in all, it is definitely a beneficial thing to think about including into your diet. But if you're not tolerant to soy, if you're allergic, because it is one of the top allergens, there's other things that you can do. It's not going to kind of push you over the edge and, oh, I can't eat soy, so now I'm going to get breast cancer. That's not what we're saying at all either.
Yeah, and just to comment, there were some studies done on, I know it was more like men that I saw men eating soy and its effects on testosterone. There was no significant difference on men eating soy versus men eating animal products. And really, I think there was also a larger study done, and it was more of a population observational study, but this was done on just testosterone levels of men. I know this was more on men that I saw. Again, men consuming soy or a more plant-based vegan diet versus men on a more omnivorous meat-based diet. And again, testosterone differences were not there. So that's a lot, especially if we're talking about TikTok videos. A lot of what we see are these big guys on there eating meat going like, you got to eat meat and you got to do this and that. And it's like, overall, you have to be careful. This should be an automatic, warning. It's like, if you're getting your medical advice and nutritional advice from TikTok, please be careful. And just, yeah, I mean, the studies just aren't there. And then personally, getting my testosterone done, as the last time I really checked, which I'm due for more labs, but this was made about 2 years ago. I'm a little bad. I should do it more often, but
You didn't check that last year, but you had labs done.
oh, I had labs done. Sorry, this was made like about 3 years ago, but this is about 7, 8 years into being 100% plant-based. My testosterone was in the upper optimal range. It was really high compared to a normal range. So I was happy with that.
That's
So
James's anecdote.
yeah, that's
Yeah.
anecdotal. If I can contribute to anecdotal, for sure.
And if we're talking about how there are benefits to hormone balance with having some of these phytoestrogens and isoflavones, but maybe you are somebody who's allergic to soy or intolerant to it, there are other food sources of isoflavones. So you can always consume things like flax seeds, wheat, berries, other legumes, and a couple types of greens. And those are wonderful sources of some of those phytoestrogens. So you can also obtain those benefits.
Mm-hmm.
All right. I love it. Love it. So we're going to keep rolling. And, feel free if anybody has more soy questions, bring them up. But we want to keep rolling into other questions all about hormones, since we know that this is a hot topic that so many of us are walking around really trying to find that optimal hormonal balance. And so much can play into it, like foods, the environment, our emotions. So many things, our genetics, our gut microbiome can significantly play into our hormones and how we're excreting them or recycling them if we're not properly excreting them. So we want to get into this and we want to be talking about it. We have a great question talking about hormones, and I'll read it so it doesn't get cut off first.
Okay.
I'm turning 40 next month and I have been struggling with hormonal imbalance and cystic breasts. I'm curious to know how plant-based folks manage peri/menopause without some cholesterol in their diet to support the production of progesterone. This is a great question. I'm going to give my input, but I'd love to hear your input as well, Laura and Katie. So yeah, this is a wonderful question. And me, of course, being someone who's so focused and obsessed with the gut, I always think gut when we're talking about hormonal imbalance, because like I said, we do know the interplay with the liver, who is really responsible for producing hormones, helping to recycle hormones. Our liver and our gut are so in tune with one another and so intertwined. So when we're talking about hormonal imbalances and things like cystic acne or cystic breasts, we want to ask, how well are we, one, how much of that hormone are we producing? And two, how much are we able to efficiently excrete? We are in constant recycling, production, excreting between our liver and our gut. So we want to ask ourselves, am I someone who has genetics where I'm just maybe producing a higher level of hormone? And two, if that's the case, what does my excretion of some of those excess hormones look like? So if you are somebody who's having hormonal or cystic acne or hormonal or cystic fibrocystic breasts, you want to ask yourself, why is that, right? Why am I producing, one, this excess amount of hormone, and two, excess fibrinogen, which is the type of protein that creates these cysts, right? Or these buildups or these fibroids, if you will. And these can be in the ovaries, these can be in the uterus, these can be in the breasts, these can be anywhere else as well. So I want to know, what does your excretion look like? Because if you're excreting on a regular basis, then you're not necessarily having that excess buildup all the time of hormones. So we know we're always detoxing. Every day we're naturally detoxing. Your best daily detox is going to be through urine, through a bowel movement or feces, through respiration, and through sweat. We're constantly trying to get rid of toxins. When we're not appropriately doing that, our body needs to figure out where to store them. So oftentimes we'll store hormones, we'll recycle hormones. So we'll recycle them back through our liver, and they can do things like, one, when they get recycled from our gut to our liver is like, oh, it's not leaving through the gut. This person's not regularly having bowel movements or complete bowel movements. Let me bring it back. It goes back through the liver, back through the gallbladder again to try to get it back through the gut. This is one of the top reasons why females are so at risk for gallbladder disease. And a majority, over 70% of those who have their gallbladder removed are female. It's because of the hormones that are consistently passing through. And when we're consistently trying to excrete and detox these hormones through our gut, and then they keep coming back over and over like a boomerang, our digestive juice, bile, starts to get thicker and sludgier, right? It starts accumulating more and more hormone in it. So that's one place where some of these excess hormones will go. Some of the other excess hormones will go to areas in the body where we have adipose tissue or fat tissue. And for females, that can be the breasts, right? Our breasts are a great source of fatty tissue, adipose tissue. So our body sometimes will say, okay, let me try to store some hormone in there, excess hormone. And then we'll protect it by adding more of that fibrosis, some more of that kind of hardening agent. So it gets almost encapsulated in there. So you do want to ask yourself, what does my daily detox look like? And then two, what does my lymphatic circulation look like? I don't think people really realize how important lymphatic circulation is as well, especially if you're somebody who has a lot of cystic issues. We have these lymph nodes, which all kind of communicate in a network throughout our entire body, really from head to toe. We have these lymph nodes throughout. And we are constantly trying to circulate this lymphatic fluid, which is a really important cleaning fluid for our immune system. And also for, those of us who have more adipose tissue or breast tissue, which is all people, right? We do have several lymph nodes in the breasts. I think as females, we are more prone to cysts in the breast because we tend to wear very constrictive, tight bras and tight tops as well. And that's going to constrict your lymphatic circulation. So you want to ask yourself, what's my detox looking like? What's my lymphatic drainage looking like? Is that getting clogged up somewhere? And then, of course, with that, what does my diet look like? Because we do know if we want to be detoxing these things out of our body and we want to be passing them through preferentially stool, that's the first place our body tries to dump hormones because they are more fat soluble. What's kind of a nice little raft for it to leave your body on? And that's fiber. So what does my diet look like? What does the amount of fiber that I'm intaking look like? Am I consuming enough isoflavones and some of these other wonderful fiber-rich foods and other antioxidant-rich foods? So that's my 2 cents on that. But I'd love to hear from the rest for you. Yeah, I gave a whole $1.
Yeah, that was 100 cents. Love it.
I would add something else too, which is like it's interesting to see how our symptoms many times reflect an area of our body, and it's good to ask, well, emotionally, how did that happen, right? And when we're talking about our hormonal imbalance, it can be many times, like you were talking about, Dahlia, the liver, right? We need it for detox and all of these big powerhouse of organ. And many times, this is the organ where repressed anger lives. Mm-hmm. So there's a big energy that maybe it kind of makes sense, as women and men, anger is a topic that is not very well understood. Mm-hmm. We don't really have a good relationship with anger. It's almost like taboo. We don't know how to relate with it. We only see it as aggression. But if we knew how to relate with anger in a more healthy way, we were able to communicate and express and put our boundaries, right? So then it becomes into deeper questions of like, well, where have your boundaries been violated, right? Or if you were having issues with your womb, like where did your needs and desires and pleasure got infringed? There's a lot of guilt, there's a lot of fear in there. Also, like how did you, like, from your mother, how did she give you the example as a mother, right? And many times when we don't have like a healthy relationship with our mom or our feminine or the caregiver, then these needs dimension kind of gets infringed, and then we have a really like high frequency of emotions that have been stored, and they get stored in different locations in the body. And then when we don't really tap into those, then eventually with time they either become projections, so stuff that keeps triggering you, or they manifest into symptoms, physical symptoms. So that's something that is very interesting to look at in the sense of like emotional work and stress, and how the body manages this energy that has not been able to go through the body, and then it gets stored, but it has a memory and it wants to resolve. So that's why it manifests, because it's kind of like a signal telling you, hey, we need to look into this. And many times when Dalia was saying like, okay, we gotta make sure that we're pooping and having all of this fluidity and mobility, well, if all of that is working, then you have to keep looking, investigating, right? So if it's not that, then you were saying, how are you eating? Then how about your environmental toxicity, right? There's many factors to all of these, but I feel like the more information you have is like the more you can dig into these deep, like a detective. And in a way, this emotional work is also like a soul detective, because all of it is correlated, it's interconnected. So yeah, there's a lot of questions to ask.
Totally. And just to kind of bring that, because I know this can be somewhat abstract for a lot of people, but just to bring a pathway down, I think, to where people can understand, whereas like when you're in this emotional state or suffering from a prolonged like emotional trauma that's lingering in there with you, are you really going to wake up early and go to the gym? Or is it a little bit more of a struggle to go get a sweat and to move your body and to find sometimes even the energy to like, I'm going to myself and make this delicious smoothie or this delicious healthy breakfast with all this fiber. So, make sure I'm getting what my body needs physically, that chemical, right? The chemical, and then helping your body. That flow can be interrupted because in the, what's the point? I'm kind of in, or you're maybe in like a fight or flight situation, right? Where you're just kind of in this daily grind of just go, 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 and not really thinking of yourself, maybe thinking of others, because it's easier to think of others than thinking of yourself. I know we're having a discussion like this in our membership group with some of the women there in the group, where it's like, hey, what's your hierarchy, right, of the day? What are your top priorities? And a lot of times it's my kids, or it's my job, or my husband, or this, and it's like, where are you in that, right? Where's that love, and where's that self-care, and where's that time for you? Where's that energy being directed to you, whether that's physical, chemical, emotional, right? And how does that then help you to get these foundational things done of like helping your lymphatic system and helping to detox, and helping, detox meaning breathe properly and have a bowel movement and all these things. So it's so interconnected. I really, really love that. But I know sometimes, I mean, me 10 years ago would have been like, what, Laura? Like, what do you mean these emotions? Especially as a guy, sometimes we're like,
They're not
emotions,
trapped.
emotions bad. Like what? Like we don't get it. So it's like, yeah, it's nice to kind of get that, I think, I don't know, flow a little bit, or understand that pathway of like, yeah, hey, if you're holding on to something, it's weighing you down, and it's that much harder to get to the gym or get to the kitchen in a way.
And we are energy, we are energetic beings. And so if there has been a disturbance, like Laura said, it might be stagnating somewhere in your body where maybe you're then showing symptoms of it. And we know that trapped emotions are now being more and more understood, and they're being implicated in so many chronic diseases, autoimmune diseases, idiopathic diseases, or diseases that they really can't identify where they're coming from. So some of these diseases of kind of just exclusion of we've ruled everything out. You don't have any of that. So we don't know. We're just going to label you as this fibromyalgia, IBS, something else nonspecific. And, in many cases, we're starting to identify it's emotional. That's really, really creating this stagnation, this overwhelm, this physical pain that's manifesting in the body. So I love, Laura, that you brought that perspective.
I want to show this pertinent comment. This discussion is really helping me to see how the social determinants of health impact hormone balance as well. Social determinants of health, just for those watching, that can also be called the exposome. That can also just be your life, right? Like where you live, work, play,
how you were raised,
like all these
socioeconomic status,
all
race.
these things that relate to your society, like your surroundings, your life. Yeah, the gut centric version of that is called exposome, like all these inputs from your life and how it's affecting your gut microbiome. For us, it's always like, how's it affecting your microbes? But your microbes play into these chemicals and the reactions of your emotions and your overall well-being. So this goes pretty deep, man. This is, I love it.
Yeah.
I love deep talk, not shallow talk. So we're all about this.
Oh man, that's my jazz too, James.
I love that we can bring in the evidence, bring in the emotions, bring in our real life experience, and
so connected.
Bring it all together because it is so important. So we had a chance to kind of discuss that, hormonal imbalance and cysts, right? Whether it's cystic breast, cystic acne. And we didn't have a chance to address the second part of the question. I'd love to hear from, you guys too about this. I'm curious to know how plant-based folks manage perimenopause or menopause without some cholesterol to support the production of progesterone. Because, that goes around a lot online as well of, if you don't eat cholesterol, you don't have cholesterol, or your hormones are going to be too low. I know there's a lot of people out there saying that. And I think that's kind of like soy, right? A little bit of a misconception, because we also want to clear up, where is this cholesterol coming from in these animal products and what are we? So Katie, I see you nodding your head. I'd love to hear your opinion on this.
Yeah. So, well, first of all, this was a really great loaded question. There's so many different aspects that flow into it. But in terms of cholesterol and being plant-based eater, being afraid that, like, do I even have enough cholesterol in my body? So cholesterol is not an essential nutrient. And what essential nutrients mean is that our body cannot produce them. Therefore, we need to get them in the diet. So you can think about them like the vitamins that we talk about, vitamin C, vitamin B12, so on and so forth. With cholesterol, our body will produce what it needs. So I like to say, like, you don't really need to worry about consuming cholesterol to get cholesterol in your body. However, you can do things to support your body during this time. So during menopause, especially menopause, and I'm going to go on a bit of a tangent, but menopause is a really important time for breast health. And of course, reducing the risk of breast cancer is important at any stage in a woman's life or with somebody who has breasts. But menopause is where the risk for breast cancer is much higher. Our ovaries stop producing estrogen. And so our adipose tissue that remains in our body, like our central, our kind of midsection belly weight that people may carry in the fat tissue around our bodies, is also metabolically active. And it becomes now the main source of estrogen in the body. And kind of bringing it back to what Dahlia was saying with excretion of hormones, we really want to make sure that we set ourselves up for success, and maintaining a healthy body weight can be one element of that, but also having a high fiber diet, which you likely have to work up and do some things around if you can tolerate those high fiber foods and kind of create a plan around that. But our gut bacteria, there's a couple different microbes in our microbiome that help us excrete estrogen, which is really important, of course, once we are in that postmenopausal stage as well. So I just wanted to throw out there that it's all connected. Like you were saying earlier, breast health isn't just about the breast, it's about the gut and emotions and all of that thing. All of those things are so intertwined.
I love that. And just as cholesterol comes from animal products, we are animals. So we, like Katie said, to reiterate that we are animals. We make our own endogenous inside cholesterol. If you are eating sufficient consuming sufficient calories and fat. So if you're eating things like nuts and seeds, and you're eating, you can include high omega-3 oils in your diet, olive oil, avocado oil, flax oil. You can also eat other foods that can increase your production of progesterone as well. So there have been some specific foods as well, like chocolate has been shown to help with the production of progesterone, or we know certain foods as well, like yams and sweet potatoes. We know certain and usually this comes in like a supplemental form, but you can eat them as well as chaste tree berries. So chaste tree berries can be helpful, and having sufficient intake of minerals and nutrients like zinc and magnesium. So again, going back to those whole foods and those foods that are rich in those sources of those minerals and those vitamins, and your body will take care of the rest. It's very intelligent. It knows what you need, and it knows how to produce it for you. If you listen to the symptoms that it's telling you, so like cysts, like, pre-estrogen or pre-cancerous cells, cancerous cells, your body is trying to communicate a message to you. Stagnation in a certain part of your body, pain, these are all messages from your body. So we hope that this was helpful, and that this gave you just a little bit of hope and some ideas of what your body really wants to do for you and what it's trying to do for you all the time.
So thank you. This was a very comprehensive answer.
Mhm.
Very comprehensive indeed. And I have to add something to that too. This is where shout out to carbohydrates, because this is taking me back to advanced nutrient metabolism and going back to college where we learned all this about cholesterol. Is like, one thing you definitely need to make cholesterol: carbohydrates, right? So it's like, and correct me if I'm wrong, I might be a little rusty on this, but right, triglyceride is part of the backbone in making a cholesterol molecule, right? So I'll double check, but someone correct me if I'm wrong. But yeah, a carbohydrate, I should probably look that up. Maybe I shouldn't say that. Well, this is live, so we'll see. But correct me if I'm wrong. But yeah, carbohydrate, I want to say, is the backbone of, and some to say, to make cholesterol. So yeah, we make that.
And we know if we're malnourished in carbohydrates, proteins, fats, that can affect our hormonal production as well, which is why a lot of times we see, especially in severe cases of eating disorder or just imbalanced lifestyle, like, professional athletes who are exercising hours and hours a day and stay very lean, like dancers, or those who are doing gymnastics. We tend to find those types of athletes, those with disordered eating like anorexia or purging, or those who are over exercising as well, they tend to lose their menstrual cycles. They go into amenorrhea because they are not consuming sufficient nutrients as a whole for their body to be producing these hormones. So our bodies are very preservative. They understand you should have hormonal balance, but you won't die if you don't have it for a little bit. So let's just downregulate some of these hormones that are being produced, because I know you'll continue to survive without menstruating, or without ovulating, or without, having that chance to reproduce. And so in those cases where we're just nutrient malnourished as a whole, that can certainly have an effect on our cholesterol production, on our hormone production as well, because cholesterol is a backbone for all of our hormones. And often in that case, vitamin D is also deficient, which vitamin D is also known as hormone D, because it's so important to our hormone function as well. So in this case, you really do, you want to take it back to not what supplement should I take, or what this or what that. You want to ask yourself, am I doing the basics? Am I eating fiber? Am I getting in balanced nutrition with my macro and micronutrients? Am I detoxing appropriately by hydrating well, so I'm urinating, by eating enough fiber, so I'm defecating and having bowel movements, by moving enough, so I'm sweating, by taking the chance to deep breathe and really have that respiration? Am I meeting those foundational basics? Because if the answer is no, and you're trying to sprinkle other things on top, it's going to make it really hard. Your body's doing this for a reason. So if you're trying to fight against what your body's trying to tell you by covering it up or forcing it and micromanaging it with supplements or other things, usually that's not going to lead you to the most optimal outcome. So something to ponder about and something to think about.
Yes. You want to move? Oh, yeah. Should everyone take a bowel support supplement? Is it safe for nursing mothers? We're just moving on. We're getting some good questions.
We're getting questions about supplements. I want to dive into them.
Okay. So bowel support supplement. Is it safe for nursing mothers?
I'm going to go ahead. I'll, if nobody else wants to start this one, I'm going to start this one of, so bile, as I had mentioned a couple minutes ago, bile is a really important digestive juice, and our liver is responsible for producing bile, and then it sends it to our gallbladder, an important organ that is a reservoir that holds the bile for us until we really need a large bolus, a large amount of it. And when you eat fat, or just when you eat anything really, your gallbladder will squeeze some of that bile out. And bile is very important for especially digesting fats, but for digesting foods in general. So bile is helpful in that breakdown and digestion of any type of food, and it's really helpful for other things. So bile helps with antimicrobial effects. Those who have had their gallbladder removed or who have had non-alcoholic fatty liver disease, liver cirrhosis, steatosis, whose livers are not making enough bile, they can often have gut imbalance, gut dysbiosis, because that bile is essential to keeping all of your gut bugs in healthy balance and keeping some of the inflammatory gut bugs down and managed. So bile does that for you. It also is important with gut motility, gut movement. It activates a hormone called motilin once it hits your small intestine. So we need bile, but do we need bile supplements? I'm going to go ahead and I'm going to say no, and not for everybody. And I never make blanket statements. So don't take this as, well, I saw you and you told me to take something to help me with my bile, or you recommended, some bitter foods. I always say for everyone, but pregnant women especially, because, you want to be extra careful. Start with a natural bile supplement like a bitter food. Bitter foods stimulate the production and the contractility of your gallbladder. So when you're eating things that are bitter, that is like taking a bile supplement. So eating bitter greens like dandelion and arugula or watercress, endive. You can eat bitter melon, or if you're having things like bitter berries or even bitter vinegars, those are a great option as a nice bitter. So maybe you're eating bitter greens and you're putting a nice vinegar dressing on them. I always make that recommendation first. My patients come back to me and they're like, oh, wow, I'm so much less bloated up top. I have less of that pain under my right rib that I was having before, which can indicate that your gallbladder or your liver are feeling a little bit angry. You want to be mindful of when it is appropriate for you to maybe take a supplement and when it's not. If you are somebody who has history of gallbladder sludge, or especially gallstones, or even bile stones that have formed in the liver, and you're taking a supplement that's really provoking you to push out bile, that can then force some of that sludge or force a stone and block the little tube, the duct that puts your bile into your gut. So that can cause a whole host of issues. We know pregnant women tend to have higher levels of hormones. So I especially probably would say if you're pregnant, I wouldn't mess with any supplements, but maybe just have vinegar in your meals, eat some of those bitter foods that we were talking about, and keep your bile flowing nicely and regularly with that instead of really trying to overstimulate.
I don't know if anyone wants to add. That was not
Mic
comprehensive
drop.
at all. Seriously.
No further comments.
And the person, I believe, said, thank you for that. All right, you're welcome. Awesome. So you guys are getting some great answers to your questions. So yeah, we love this.
Thorough question.
Very thorough.
Answers, I mean.
Do we want to, I think there's more question, but yeah, we're kind of we could be here all night, but do you want to show another clip of something? What are we thinking here?
Well, I know
there was a question.
Yeah,
go ahead. There was a question on Instagram, and this question was related to period cramps and how it was related to food. And what I would have to say about is inflammation. We want to be mindful about foods that contribute to inflammation, which mostly is like highly processed foods, packaged foods, and highly processed meats too. And also, yeah, like you want to be very mindful of like getting your fiber, eating more vegetables, more fruits that have more antioxidants, omega-3s, for example. So to reduce the inflammation, maybe that's a supplement form, or if you're taking food options, which include walnuts, maybe?
Walnuts, hemp,
Mhm.
chia,
Chia,
Flax.
yeah,
flax.
Mhm.
Yeah.
avocado.
Algae,
And I know
seaweed.
histamines have a big part on that too. And I know,
Mhm.
Dahlia, you are the queen of histamines, so please delight us.
The hista queen,
So,
if you will.
Hista
I'll take
queen.
it. I'll take it. I love talking about this topic because I tend to find that in my patient population, they'll say, oh my gosh, I don't know why I was fine last week. And then this week, my gut is a mess. And we'll talk through what has nutrition look like. Nothing's changed. What's your stress like? It's fine, managed. And I'll ask, where are you in your cycle? And that sometimes will reveal gems for us because we do know that throughout a female menstrual cycle, we are having varying amounts of hormone, and these hormones will have effects like releasing certain chemicals in the body. So, when we are in this first part of our cycle, which is the menstrual phase, that's when you're actively bleeding, your hormones are pretty low. And that's what's enabling your endometrium to kind of shed, the lining of your endometrium to shed, and you're not, you didn't implant an egg, you're not going to nurture a baby in there. So you're shedding the lining of your uterus. So you're bleeding. Your hormones are low. You don't really need them. In the next phase, when we start kind of entering, when we are in that follicular phase, but we start then trying to restart the cycle just in case we are going to get pregnant again, our body says, okay, it didn't happen last month. Maybe it'll happen this next coming month. So let me prepare for ovulation. And that's when our hormones start to kind of tick up, where we'll start to produce a little bit more estrogen, active estrogen, which is called estradiol, especially. So I always ask women, is it around the time that you're ovulating where maybe you do feel more bloated and maybe you are feeling a little bit more symptomatic? And a lot of my patients will say, oh, yeah, I'm ovulating right now and I'm really bloated this week. So estrogen is actually one of our hormones that releases histamine. So it can be around that time before you're ovulating that you feel more bloated, you feel more irritable, you have headaches, you're feeling just a little bit more hormonal, and your hormones are kind of changing. And then sometimes they'll say, I'm okay after that, after I've ovulated. And then when I'm in this luteal phase, where again, my body's trying to either fertilize and nurture this egg or understand the egg didn't get fertilized. I don't need to nourish it. It's not going to implant in the lining of my uterus. I need to shed it to get ready for the next month. So then you're getting ready to either again nourish the egg or menstruate again, and your hormones peak again. Just in case you did fertilize that egg, you need that progesterone and you have more estrogen. So it's again at this time you have a little bit more estrogen. You might be producing a little bit more histamine because the estrogen releases histamine. Thankfully, though, progesterone comes in. Progesterone can actually decrease histamine load. So that has that benefit that week before your period. But it is interesting to kind of understand how our hormones play into that. And then also the health of our reproductive organs plays into our gut health as well. Because the analogy I like to give to my patients is if your house is on fire, your gut is on fire and it's inflamed, your neighbors' houses might catch on fire too. And for us, our reproductive organs are neighbors. So it's not uncommon for my patients and I to say, okay, you've dealt with years of these gut issues. You've done every elimination, reintroduction under the sun. You've taken all the different types of medications. You're doing pelvic floor therapy and you still have bloating and discomfort and terrible periods. So a lot of times then we discover maybe you should see someone to get assessed for endometriosis, where the lining of their uterus or the surrounding tissue is significantly inflamed. Again, the gut was on fire. And if you're trying to dump trash in the recycling center and it's on fire, you're like, oh, never mind. Let me just put it somewhere else. But then, the surrounding buildings will start to catch as well. So that's when hormonal issues can start to happen and inflammation and some of the other surrounding organs will happen, like the reproductive organs or the bladder. So I love that question.
Very good question. In summary, again, you see your body is doing quite a bit. So if you need professional help, seek professional help with someone who really eats, sleeps, and breathes this, and they can help guide you. Again, you don't have to be an expert mountain climber. You can get a guide up your journey, up your health mountain for sure.
And start with those foundational basics and always defer back to that. Am I doing this? Did I sleep well? Did I move? Did I nourish myself with fiber and whole foods? Am I hydrated? Am I dealing with stress? And if your answer is no,
Am I taking
start
the
there.
time to rest?
Am I taking it? Yeah. Am I listening to my body?
Dahlia popped on another great question. She's like going hard. Do you have any advice for me as a pregnant vegetarian, 2 months along, who is also breastfeeding a 9-month-old in terms of meeting protein and calcium needs? So still on the topic of women's health, switching gears to pregnancy a little bit. Lots of topics with women's health for sure. So yeah, so any advice with this? I know. Yeah.
Yeah, I can jump in. I can start with the calcium needs for somebody who's not, if you're a vegetarian, you may be consuming dairy, but if you are more plant-based and aren't consuming dairy, things like, I really like fortified plant milks as a really quick and easy way to get in that calcium. A lot of them now are fortified with just as much calcium as dairy milk, if not more. I think Ripple is one good brand that I personally like because it does have high amounts of protein, but also has that high amount of calcium as well. I would point out that not all plant milks are fortified, or if you're not interested in fortified plant milks, there are still other options from like the plant world and the food world. Calcium set tofu is always a really great option. Coming back to the soy as we started our talk with, but you also have vegetables like bok choy is another really great vegetable that has that calcium in there too.
Mm-hmm.
Yeah, to piggyback on that, collard greens, kale, mustard greens, turnip greens, yeah, even soy, going back to soy, soybeans have some. And so yeah, collective, and then context of that too, vitamin D levels. Your vitamin D is very, very important to your bone health. So even if you're intaking all the calcium in the world, but your vitamin D is suboptimal, vitamin D is not on your radar. Very, very important. So especially if you are pregnant and you are essentially building a brand new human
And breastfeeding,
and
another one.
and then the next phase, breastfeeding, you will need to be on top of your nutrients. Very, very important. So yeah, dissecting this. So
creating that intention around having meals throughout the day, having your regular meals, having snacks, hydrating well, and maybe you're hydrating above water, right? Maybe you're drinking some fortified plant milk instead of just with water, and getting both hydration and calcium and some protein from some of those plant milks. So you're really trying to look for those sources that have additional nutrients while you're getting that hydration to help your breast milk supply, and trying to bring in additional protein, additional calcium. But really, I would say there's no magic pill when it comes to breast milk. We have found this. It's really getting in enough calories and making sure that you're able to nourish yourself. And I remember those days of breastfeeding and sometimes feeling like a prisoner or feeling trapped. And, sometimes we'd let ourselves go. But I would say, especially in this case where you are nourishing someone else, you're nourishing yourself, and then you're building a brand new person, it's making sure that you are eating enough and eating some of those foods that Katie and James had mentioned as well.
I would reiterate what you already mentioned, Dahlia and James, many times, that especially with these specific cases, advice from a professional, someone that really knows your case, someone that really knows your specific individual needs, because like you just said, Dahlia, I mean, you're nourishing 3 people. So you really, really, really want to make sure that you're hitting the right amount of nutrients, not just for you, but for the babies and everyone else that is dependent on you. So yeah.
If there was ever a time to get professional help, it is when you are nourishing 3 people. Like, go for it. It's not, because that time is not going to be forever. And those first 1,000 days of your child's or your children's lives, I should say, are vital, super, super important, foundational, and it's a phase that you can never go back and redo. So yeah, if you're having questions, if you're not sure, seek professional help. It's worth it, especially in that concentration, that magnified effect it can have for you and your 2 children.
And those 1,000 days of life are the times of building their immune system, their gut, and their brain. So Yeah. Love
And
that,
also,
Laura.
I'd like to add that they don't really talk a lot about it because it's all about creating the baby, pregnancy, and all of that. But what happens after
Mm.
you have the baby, the postpartum, that fourth trimester, it's vital for the woman that gave birth.
Mm.
Yeah.
And I think a lot of the planning goes into how we will receive the baby and what we will do
Mm.
before the baby arrives, but we don't really plan our postpartum, like those 3 months after we just had a baby, and how important it is to get support and, again, nutrients needs and
Mm.
all of these
Rest.
things.
Mhm.
Rest, a big support, someone that can hopefully help you, right? Around you. Like, unfortunately, today we're like very alone in
Mm.
pregnancy. Like, we just have to do everything on our own. And before, we had tribes and elderly taking care of the babies, and you could
Mm.
take care of yourself. And yeah, it's challenging, but I think it's
Mhm.
worth it to plan those postpartum months.
And yeah, that might be the time where you're saying, maybe I don't have support. Maybe
Mm.
my partner is either not in the picture or works or not able to support. I don't live near my family. I don't know when I'm going to cook and prep, because that could be an option, right? Having freezer meals for after your delivery. But if you're like, I have a 9-month-old, maybe that's the time where you're saying, okay, let me do some meal delivery and someone else is cooking for me. And all I have to do is heat it up. And that is going to make sure that I'm not skipping nutrients for myself or for these other 2 lives that I'm nourishing. So it's always looking to your resources as well and saying, what is going to help me right now keep balanced?
Mhm.
Okay. We have one last question and then
that we're seeing.
we're
Yeah.
going to sign off. I love it. This was such a great topic. We usually go about half an hour, an hour, but it's evident that there's so much around this topic we want to know about. So we'd love to do a part 2 if you would all want to have us do a part 2 or hear a part 2.
Let us know in the comments below.
Mm-hmm.
But this question, can female hormone imbalance cause gastroparesis? Maybe explain that whole.
So gastroparesis is basically partial paralysis of the stomach or improper movement or contractility of the stomach. And so we know that many different things can cause gastroparesis, or your stomach to not move and contract and excrete stomach acid and help you digest as it should, because most people know that your stomach puts stomach acid into the food and that partially breaks it down, but your stomach also physically contracts and physically moves and squeezes the food through. So if you have gastroparesis, there's stagnation there. And so in gastroparesis, oftentimes you're not able to eat very large portions because food is sitting in your stomach for a much longer period. And that can cause different things like nutrient deficiencies, or that can cause nausea, vomiting. It causes your body to want to just get the food out if there's too much food that comes in when it's not able to process it at a regular pace. Can female hormone imbalance cause gastroparesis? I mean, I am not thinking of anything off the top of my head, any studies that have definitely said yes or no, but I just haven't looked into it yet. So perhaps yes. One thing that I can think of is, as I mentioned before, that bile being so important for motility. And if we constantly have a backflow of bile, if we're not properly excreting bile into the small intestine, then the stomach will kind of stagnate, because we need that bile to communicate with our stomach. And we need our gallbladder and our liver to really be in communication with that. Our bile has to turn off the acid that comes from our stomach into our small intestine as well. And if we said that hormones, an excess of hormones especially, can supersaturate our bile and cause it to be thick or cause stones to build up, then there is a possible feedback there between the stomach and between our liver, our gallbladder, and how those are functioning. So I would encourage you to ask yourself, what's my health history as far as my liver, my gallbladder? Am I someone who's been told you have high liver enzymes? Or maybe you've had an ultrasound and you've had non-alcoholic fatty liver disease, or, like I was saying, one of those more progressive conditions like liver steatosis or liver cirrhosis. You've been told your gallbladder is functioning at a low capacity. So you want to ask yourself, how are those organs functioning with one another? And how is that affecting the way that the rest of my body is working?
And really quickly, or maybe you haven't been told any of these things and you have no idea, but you're feeling this. So it's time, let this be whoever's watching. It's time to look into this, right? Or it's time to get these questions answered and find a team that can help you answer this. So
maybe you're saying, okay, I hear you. I'm going to eat my bitter greens. I'm going to have some vinegar and see if that helps. Have other bitter foods like green tea or turmeric, ginger, okra, and see if that's something that helps with your specific case of gastroparesis. But there can be many cases. Other infections can be causes, nerve dysfunction, so many causes for gastroparesis. But I'm going to have to look into that and let you guys know more next time. A couple people said yes, definitely yes. We want to hear more about hormones. So we'll have to follow up on this conversation with part 2.
Yes, def. And then another one said def. Love that. Yes. And thank you. Again, thank you so much. And we'll see. You guys can see. I want to see. Oh yeah, there we go. Oh, let's see. Oh, it's not working. We're trying to overlay the chat, but yeah, we're seeing your comments in here. We love the comments. Yeah, we're seeing thank yous. Thank you guys for watching and tuning in. Yeah, I want to be mindful of everyone's time. So I know we could easily do a whole nother hour. There are other clips we wanted to show, but we'll save them for a part 2. I think this is a massive, massive topic that's so, so important. Yeah, we're getting some other wonderfuls, and thank you so much. And I would love to do a part 2. Again, I'm more of a spectator here and facilitator. I love hearing from everyone's perspectives on women's health. And would love to do this again. If you like this, again, comment down below. If you want to send us ideas or topics or clips you want us to react to, again, send that to info@marriedtohealth or anywhere through our social media channels. We'll get those collected and take a look at them. We'd love to do that. I love this idea.
And outside of connecting with you both through Married to Health, where can they connect with you, Laura? And Katie, we'd love to hear where they can connect with you as well.
You could connect with me via Instagram, The Emotional RD, and LinkedIn with Laura Sanchez. So please don't be strangers and come send hello and send some questions.
Yes.
And people can see me. I'm on Instagram and TikTok at katiechakos.nutrition. And I'll also post the references that I mentioned earlier in the talk as well. So if you wanted to look more into some of those topics, you can see them on my stories later tonight.
Thank you, Katie.
Beautiful.
Love it.
And guys, we have quite a bit on our blog at marriedtohealth.com with whether it's carminative herbs or thyroid health and even some on women's health, and more blogs and topics coming with references and sources cited. So if you want to dive deeper, look into the peer-reviewed journals or read the blog, head over to marriedtohealth.com, link down below as well. Thank you all so much. We appreciate your time. We appreciate everyone watching and everyone participating. We hope everyone has a great weekend who's watching live, and we'll see you next time. Again, we're going live twice a month. First Friday of the month, dietitian talk, and the second time in the month, we're doing our Good Gut Live. So stay tuned. We'll see you all again very soon.
All right. Heal with each meal.
Heal with each meal. Thank you, Laura.
And feel with each meal too.
And feel with each meal too.
Love it. Thank you all. Happy New Year.
Happy New Year, everybody.